Of the Pharmaceuticals and Healthcare Association of the Philippines and Attorney Froilan Bagabaldo of the Philippine Pharmacists Association. Good afternoon. Thank you so much for joining us, gentlemen.
Good afternoon.
All right, first off, we're talking about counterfeit medicines because this is the National Consciousness Week regarding counterfeit medicines is happening soon. Tell us about this event.
Well, there is a presidential proclamation which declares the third, or I think the last week of November as the National Consciousness Week for counterfeit medicines. And one of the objectives here is to inform the public to be wary, as you said, wary of drugs that may be counterfeit. There is a proliferation of counterfeit medicines, not just here in the Philippines, but all over the world.
How bad is it out there? I mean, do you have a specific banner case of someone actually taking counterfeit medicines and which resulted in a severe way?
Well, we have
not one specific case, but have we documented the cases, the actual cases where fake medicines were?
Well, since the special law on counterfeit medicines was passed, that was in 1996. There were a few cases that were resolved in court, and some people were sentenced to imprisonment. But one difficulty that we are encountering is if this, although the law, well, I think Attorney Bagabaldo could talk more about this later, the law says that if a patient dies as a direct result of taking counterfeit medicine, the penalty would be much higher.
Yes.
But as any lawyer would know, it is very difficult to prove that the cause of death of a patient was the counterfeit medicine that was taken.
Exactly. So how are you dealing with these cases, Attorney? And just give us an idea of how many people are coming up to you, relatives of those who may have died, or those whose illnesses became more severe because of taking counterfeit.
For a long time, our association, the Philippine Pharmacists Association, has been receiving reports in various parts of the country from our chapters, reporting that they uncover several kinds of drugs, whether branded or generic, that are counterfeit. And
so generic in a counterfeit na po?
Yes. And in fact, we conducted several rounds from among our chapters, pharmacists, informing them on how to detect counterfeit drugs. And we came up with some posters indicating how to spot counterfeit drugs from the original drug.
All right, give us some of these tips for those who are listening and are curious, because of course it's ironic if you go to a drugstore wanting something that will cure your loved one, and instead it will harm your loved one.
Let me just start off with what Mr. Tantia said earlier, that first and foremost, you have to procure your medicine from a reputable source. And because we received reports that in the rural areas, even in the marketplace, they are sold just like the ordinary merchandise, like somewhere in Bilao or just in the corner. That's first. Second is that from the packaging itself, I mean, the ordinary layman may not be able to spot this one, but as far as the pharmacists are concerned, and those who receive our tips and trainings, from the packaging itself, we can spot the difference between the let's say a blister pack.
Okay, the one that we're looking at on our screens, Attorney Bagabaldo. So the counterfeit, how is that different from the genuine? Parang mas walang air sa loob ng isa.
No. In most instances, the printing is different. The font may be different. The color of the print may be different. But you cannot just easily spot it without really comparing with the original one. It is. That's why we're raising the awareness, and first and foremost, giving tips to the consumers.
And how do you do that, especially that this kind of information is, in fact, well, shall we say, more essential to the consumer than to the pharmacists, because it's the consumers directly buying the fake and counterfeit medicines.
Yes, sir, but you know, some of these counterfeit drugs happen to go through the ordinary drugstore.
Really?
Yes, some of this.
What's an ordinary drugstore?
I mean,
define an ordinary drugstore.
The reputable ones are, of course, the chain drugstores which have intricate system of procurement. The small drugstores, and I'm not saying that all of the small drugstores are like that, but there are. So I think we have to train first our pharmacists there who happen to be involved in the procurement to spot this already at that point.
Who helps you detect whether a particular small drugstore is selling counterfeit medicines? I can imagine you'd need a lot of people to be checking, to do inspections. Coming from which department should it be? Department of Health?
Particularly the FDA.
The Food and Drug Administration sends inspectors from time to time. They visit these drugstores. They look at the stock rooms or the warehouses of these drugstores.
But I believe that there are only a small number of these. And as I mentioned earlier, with regards to those who procure their medicine in the marketplace or not in the proper outlets, I think we have to reach out more and train the layman on how to spot this.
In this particular case, the drugstore and the consumer could be both victims of counterfeit medicines. What's being done to run after the sources? Wholesaler, distributors? Is there any specific campaign to actually run after these people?
Well, the Food and Drug Administration is doing this, and they work with the police agencies. And from time to time, maybe you hear or read in the papers reports about raids that were conducted. But it is difficult, going back to what I said earlier, it is difficult because in the case of medicines, the retailer may not know that what they're selling are counterfeit medicines. The buyer may not know it also. Unlike the other goods, like pirated CDs, where both the seller and the buyer know that what they're buying are counterfeit.
That's really tricky, isn't it? If the pharmacist doesn't even know that it's counterfeit, how do you expect the consumer to know that it is?
And no, we have associations against this counterfeit. Like we and the group of Mr. Tantia is involved in this. The Samahan Laban sa Peking Gamot.
We have also formed a Safe Medicines Network, which is composed of several industry organizations and also professional groups like the Philippine Hospital Association, the Philippine Medical Association, and the Philippine Pharmacists Association.
But we don't have a documented case where someone died because he or she took counterfeit medicines. Because, as you said, it's very difficult to prove, isn't it?
That is another thing that we would like to bring up, that we urge people who suffer adverse events or adverse effects from these fake drugs, or not even fake drugs, to report. That's the problem. Many people suffering adverse events due to use of medicine, improper use of medicine, or fake medicine are not reporting. So I think that should be one avenue that we have to look into and give more efforts.
Because of ignorance as well, perhaps. Maybe they're being told it was something that was bound to happen because of your medical condition, or maybe they wouldn't have equated it to the medicine that they took.
That's correct. Well, say for example a patient who has been taking antihypertensive drugs, and after taking a few of this, he finds out that his blood pressure is not being controlled. Well, he has to go back to the doctor and show the doctor the medicines that he bought from a retailer.
Important to keep the packaging.
The packaging, yes.
Of it.
I would like to emphasize the role of the pharmacist there. The pharmacist should be able to explain to the patient the proper use or the contraindications of these medicines, because the doctor is not always there. Once the doctor prescribes, the medicine is dispensed, so the last person that the patient deals with is the pharmacist.
The pharmacist.
It's always a reality that the catch in this particular case, in this particular problem, is always the price. Now, the Filipino consumer will always opt to buy cheaper medicine. So how do you actually campaign? Tell the people that sometimes there are other considerations that they have to take aside from just the price.
There are other. It's true. There are other considerations.
In fact, I think the proliferation of counterfeit medicines is brought about by prohibitive prices of branded medicines.
No, that assumption is not exactly correct because according to the World Health Organization, even generic products, which are cheap, are being counterfeited because one of the considerations of counterfeiters when they choose which product to be counterfeited is the demand. They don't want these products to stay long in the shelves of retailers, so they choose medicines that are in high demand.
Is counterfeiting also a major problem in first world countries as opposed to third world countries where the counterfeiters find lucrative to invest on?
Yeah, again, going back to World Health Organization figures, we are told that the range could be from 1% in well-developed countries, and it could go as high as 40% in underdeveloped countries.
And how much is it for the Philippines?
Well, we don't have clear data here in the Philippines because, as I've said, it's really difficult to determine which or how to determine whether a product that is being sold in by a retailer is a counterfeit or not. But the thing is, as long as there are counterfeit medicines in the market, we should be concerned because somebody is bound to be victimized.
Based on research or previous information, what did you find? Were they pricing these counterfeit medicines at the same price as the genuine? Because then that would be one thing that would fool consumers, because if it's the same price, then you'd think it's the same deal.
If it goes through the regular outlets, I would assume that they would sell it as much as the original ones.
So walang hindi factor dito yung presyo.
Yes, but as I mentioned earlier, in the marketplace, definitely the price is much, much lower.
Okay, right. Before we let you go, National Consciousness Week is happening November 21 to 25. Tell us what we expect, what are the highlights, what events will take place.
Well, based on that presidential proclamation that declares the last week of November as National Consciousness Week for counterfeit medicines, the Food and Drug Administration organized a committee to prepare the activities for this week. And starting tomorrow, we will have some activities in Muntinlupa because the Food and Drug Administration is located in Muntinlupa. And we have the full cooperation of the city government of Muntinlupa under the city mayor.
Right, the theme for this year?
The theme is, well, it's, no, I could not.
That's all right. We are flashing on our screens anyway the numbers for those who want to report counterfeit medicines, and there are quite a few options. They can do it via email or go online or call or send an SMS. Attorney, your last bit of advice to consumers out there?
First, let me assure you that the Philippine Pharmacists Association has a continuing drive against counterfeit medicine. And as an advice to the consumers, I would say that please buy your medicines in reputable drugstores. I'm not saying by reputable drugstores, it doesn't mean a big chain drugstores. It could also be the smaller drugstores, but who are known to have a stringent system of procuring their medicine for retail.
Mr. Tantia?
Yes, aside from advising the public, the consumers, to buy their medicines from reputable drugstores, we also advise retailers to get their stocks from authorized distributors, legitimate distributors. This is a way of preventing the entry of counterfeit medicines into their inventory. we are also, as part of the activities of the Safe Medicines Network, we're also going down to the grassroots to educate people at the barangay level. And we are doing this through the barangay health workers with the support of the Philippine Pharmacists Association. We have already conducted a number of seminars with the barangay health workers, and they have been instructed on how to detect counterfeit medicines.
And on that note, we'd like to thank you for coming to us, ANC, Mr. Tantia, and Attorney Bagabaldo. Thank you.
Thanks so much.
Thank you.
We'll take a quick break. Up next, an update on the SEA Games.